How is using an AI health co-pilot better than just simply jumping on the internet and Googling something or scrolling through WebMD?
Well, that would be like, what's better, talking to a stranger on the street about your health or talking to a doctor? Like, when you create a custom GPT, it has context of all your personal information. It's not just when you go into Google and you ask information, it's treating you like billions of other people on this planet without any context of who you are. If I'm asking a custom GPT information, it is specifically trained on all the information about me and my history, and then will give a response that is custom built based upon that information.
How will AI continue to be put to use in healthcare? In addition to this co-pilot, is it going to replace doctors and nurses someday?
Well, I think there's certain things that doctors and nurses do that they don't need to be doing anymore, like writing prescriptions, for example, or booking people's next appointments, right? I do think that the higher value, more human aspects of being in terms of talking to people about their health and the long-term choices that they need to make and dealing with some of the mental and emotional repercussions of the ailments that people face will always be a role for a human. But when you look at something like a radiologist who reads an x-ray and essentially just looking for patterns, over time, you're talking about AI doubling in its power and potency every 7 months. So that means 3 years from now, it's going to be at least twice as powerful. Your doctor is not getting twice as good in the next 3 years. In many cases, they're getting slightly worse over time because we have that kind of cognitive decline. So I think over time, you're going to see more and more functions of healthcare be driven by AI. And of course, there's lots of questions about privacy and accuracy and all those things. But, we were once at a point where people never thought that individuals were going to be posting about their vacations or pictures of their kids on social media. And now that's all we see. I think over time, we become desensitized to some of those issues if we're getting value on the other side. And I think there's a tremendous amount of value to be gained, especially in a world of rising healthcare costs, by implementing AI into the way that you look at your health.
That's such a fascinating conversation. My thanks to Matt Britton. Tomorrow, I'll share the second half of our conversation, looking at the broader impacts and concerns around AI in the workplace.